Next on the agenda is a presentation from Joronda, representing the Tempe Coalition, and she is going to train us on the strategic prevention framework, as well as 7 strategies for community change. So Joronda, the camera is yours.
Scotty, before we move on, we did have someone just join us. Jan must have come in.
Oh, Jan Vidimos. Do you wish to introduce yourself?
Hey, I'm Jan Vidimos. I work with Pinal County Public Health. Sorry I was late.
It's okay. Thank you.
Oh, we're glad you're here. All right, Joronda.
All righty, I'm going to go ahead and share my screen. So just make sure that there's no obstructions in front of it. Can you all see that? Yes, okay, awesome. All righty, so today we are going to take some time to take a look at the strategic prevention framework and 7 strategies of community change. The executive committee has already received this sort of training. I didn't facilitate that one, and the information doesn't change. So some of it will be a recap for them. Just by a show of hands, if you are not on the executive board, is there anyone in here who is familiar with the strategic prevention framework? So I kind of know who I'm working with. No? Okay. Okay, awesome. Perfect. So then it makes it look like I give you lots of information. All right. So let's just jump right into it. I will tell you this right away. I'm going to condense quite a bit of information into a very brief overview of it, because we are going to spend 30-40 minutes or so in here, and we're actually going to do a little bit of work in it as it relates to what you all are trying to plan for the next 4 months and then beyond, you know, to continue to use it beyond. So so I'm going to spend the time giving information and then asking for information from you all. And I know that Shelly is taking notes and Vanessa's taking notes as well. We will also use the chat box, so we can always go back and have those notes as well. But let's just get into it. So training objectives for today, we are going to take a look at effective prevention and get hopefully a pretty good understanding of both individual and community level effective prevention. We're going to look at the strategic prevention framework as a process that sort of navigates us through that. And so with that, this is actually the strategic prevention framework. It was developed by SAMSHA, Substance Abuse Mental Health Services Administration, and it is this 5-pronged process. As you can see, starting with assessment. If you look at the top of, sometimes people call it a flower. I like to call it a ninja star because I like the little thing in the middle. And I like the analogy that if you throw it out into the community, it can be pretty effective. And with that, starting with assessment, you may start there and move your way around the circle or the flower to starting going to the right. So assessment followed by capacity building, then planning, implementation, evaluation, and it all rests on sustainability and cultural competence. So I am going to go through each one of those in a little bit more detail, and we'll stop at different points so that you can kind of try on what it feels like to be in that part of the process. So don't forget this flower and what this flower looks like. So what's really special about the SPF, and I'll say SPF for short, what's really special about it is a community health approach. And it eliminates that need or that maybe sometimes that practice of operating in isolation. One agency is doing their own thing, another agency is doing their own thing, even though you see overlap or crossover. With the strategic prevention framework and coalition building, you get the opportunity to work together and target the same issue, and sometimes from different perspectives. It is driven by outcomes and data, and it focuses on not on population level change as opposed to individual change. So I might be able to change the way that I think, the way that I believe, or you might be able to have an impact on one youth and their thoughts, beliefs, and knowledge, and maybe behavior. But if we can do that on a community level, we stand the chance to have a much greater impact. So think about, for example, there was a period of time where there were no universal seatbelt laws. And we saw great numbers of accidents and fatalities and all of these things. And then seatbelts became a universal thing that not only began to be in every car. If you're old enough, you may remember cars didn't always have seatbelts, or they didn't have the shoulder seatbelt. So we get to the point where we've made seatbelts safer, and now everybody just kind of has that common knowledge, snap in your seatbelt when you get in the car. So that's sort of a population level change that happened that hopefully has made our trips, you know, in a car from point A to point B safer. This process is steeped in data. Just like that seatbelt example, it is steeped in data and data driven. So whichever direction we move, we're trying to make sure that we're doing it based on the data that we've accumulated. And we'll look at what type of data that is. So again, these are the 5 steps. It's just in a linear fashion. It's the same thing as the flower, starting with assessment, moving through evaluation. Although we start with assessment the first time we do it, it's not the only time we'll do assessment. We will end up coming back to assessment as we move around the circle. As we move all the way to evaluation to see, is it working? Did we do things that we thought we would do? Did we get the outcomes we're looking for? Did the process work? What was the impact that we had? Then we move back to assessment to gather more data to see, do we stay on that same path, or is there another path that we need to go on? So let's start with assessment. So there's 2 different types of data that you can think about. There's quantitative data and there's qualitative data. The easy part to remember that is the quantitative data, that's always going to be the numbers. What do the numbers say? There's usually some sort of structured instrument. In the state of Arizona, we have 2 youth instruments, for example, that are widely used. That's the Arizona Youth Survey and the Youth Risk Behavior Survey. Those 2 surveys tell us 30-day use for kids, lifetime use for kids. It gives us some other risk factors that kids are up against, as well as protective factors. It's very generalizable because it's anonymous, so we can say that in Pinal County or in Maricopa County, these are the things that happen. But the qualitative data really is going to give us the information about our community. So what does that look like in Apache Junction? If I were to go out and take a camera and I could see what those numbers look like, what would I see? So think about that. If I took a camera right now, my cell phone or whatever, and filmed what our strengths and what our weaknesses are in Apache Junction, what would that look like? That's the qualitative data. There's many ways that you can collect qualitative data, but it is the story behind the numbers. So collection methods. These are some of those ways. You can do surveys for quantitative data. You can do focus groups. I tend to really like focus groups because you're going to hear from the people in the community why they believe the numbers are the way that they are. You can do observations, literally the coalition going out and maybe observing community events that you already have, maybe observing what happens after school games or what happens during a particular time of year, or maybe looking and counting the type of signage that you have across the community. There's lots of different ways you can do observations, and that is another viable collection method. You can also do interviews. Face-to-face interviews would be you as a coalition member having an opportunity to have a face-to-face conversation with someone who you feel like has more information about what's happening in the community or more information about that particular sector. As you all know, the sectors that you represent, it might be easier to go into that sector and have conversations with individuals who would be valuable to get that information from. And then the last collection method that I'll mention would be secondary data. That secondary data, that's those numbers. It's not the primary data. The primary data is all the stuff before that. The secondary data are those numbers. You always want to include multiple methods. You want to have a mixture of quantitative and qualitative data. So what you're trying to assess, we're trying to assess levels of substance abuse consumption, for example. So levels of substance abuse and consumption might be one of those. We also may be looking at overdose rates, or we may be looking at levels of citations based on substance abuse or substance use. We also want to look at the consequences, and those are the related problems. What has happened as a result of that substance use? And then who has that happened with, and where has it happened? And those would be the stories. Okay, so then we need to analyze the data. And as we analyze the data, this is really what's going to give you, as a coalition, the opportunity to determine what will be our focus. You might find that there's 5 issues, and in 1 year, there's no expectation to address every single issue, but it's a nice way to have a talking point to say, okay, maybe you have a long-term plan that's over 7 years or so, let's say 7 to 10 years, long-term plan. But in year 1 to 2, what's going to be our number one priority? Things may change down the line, but we know right now this is a priority because of whatever reasons. What's contributing? What are the contributing factors to that priority? Not only do you want to look at the numbers and what's causing it, but what's already going into helping this issue? What are your community resources? And does the community have the readiness to deal with it? So right now, what I'm going to do, I'm going to drop a document in the chat box for you all. Because I can't go over all of it, it'll be useful for you to have these different documents. Let me move your faces out of the way and grab this document for you. Okay, so it's uploading. It should be in there now. So this document, I'm not going to go into it too much, but these are your community stages of readiness when you're looking at what position is our community in to deal with the issues that we're talking about. We know that some issues have been talked about for a longer period of time, and people may be a little bit more comfortable to discuss it, like alcohol, tobacco, marijuana. Obviously, vaping has been a newer thing in the last decade or so. But right now, as we're going to get to counterfeit pills and fentanyl and opioids and prescription drugs, is your community, is Apache Junction ready to discuss it, and where would they fall? So as you look at that document, you see the first stage of readiness is no awareness at all. So if that's where you find in your discussion that that's where the community is, then you would use prevention strategies that move the community from that first stage to hopefully the next stage, or maybe even 2 stages down. But you don't want to go in too far, for example, like a planning stage when the community is not ready for that. So it kind of gives you a nice roadmap to say, okay, we're going to move, we're going to move through our stages of readiness in this way. And we hope that in 6 months that we're at a new stage, and then we'll look at new strategies, or in a year, we're at a different stage. So hopefully everyone was able to open that document. Okay, so let me move my chat box out of the way. So here's your first question, first activity. Right now, just thinking about the sector that you represent and thinking about where I said the data may come from, what data is available from your sector? And what's the source of that data? And I'm just going to have you all drop that in the chat box. So think about that for a second. What data is available? It might be hard numbers, the quantitative data, or it might be qualitative data because maybe listening sessions have already happened, or focus groups have already happened, or some sort of interviews or something have already happened. So go ahead and drop that in the chat box. And while you all are doing that, is there anyone who would like to kind of speak on the data that you know is available, or you have a pretty good idea that that data might be available? Oh, I see. Okay, we have public records from city and county departments. Absolutely. Hard criminal justice data from law enforcement and probation. Absolutely. Any others you all want to chime in on? And I'm gonna totally put her on the spot. She has no idea I was gonna say her name here. Thank you, Jan. Larger data sets, yes. And there's several, and this one is BRFSS. What does BRFSS stand for? I don't think I know that. Or what does it cover, maybe?
It's the Behavioral Risk Factor something survey.
Yep. Okay. Awesome. Awesome, awesome. One of the things that'll be really important, because AJ sits between 2 counties, is to get the county data, yes, but figure out ways where there might be organizations or entities within your particular zip codes that might have the data related directly to those zip codes in Apache Junction. And specifically for you all, it's always nice to have zip code specific data, but because you do fall between 2 counties, your data may be so generalizable that it really doesn't tell you enough about really what it looks like in the community, which is why qualitative data is important, but the numbers, how can we pin down this actually happened in our zip codes? Finding out if they're keeping data by zip code or jurisdiction or something that relates specifically to your boundaries, whatever the boundaries look like for Apache Junction, how you all have defined it. Okay, awesome. So that was activity number 1. Let's move on to building capacity. So building capacity, you all have been doing that quite a bit. And obviously there are a couple of new faces on this call. And so building capacity continues to happen. It never stops. Some of the key components in here and kind of the gems or gifts are that, 1, it improves awareness that there is an issue in the community, or there are strengths in the community that you want to continue to build on. It strengthens the partnerships so that people aren't operating in isolation. It also helps to build new collaborations. Maybe there were people who didn't know that they should be involved, but especially in a smaller community, I've seen numbers anywhere from the census data for AJ, anywhere from 35,000 to 41,000 residents, like permanent residents. I know that changes. Shelley is and made me very aware of that. That changes depending on the time of year. And so that doesn't mean that you want to eliminate those people. There's other ways for them to get involved, and that might be some of the new collaborations. It also improves the resources. If you need to get awareness out, you have way more people who are going to many different places that would help to improve the resources that you have to get information out there. It also is a way for workforce development. As a coalition, you're going to be doing a ton and are already doing a ton of training and awareness building. And so as the workforce, younger people come into the workforce, new people come into a new field, it helps to build that workforce to develop a more knowledgeable, passionate workforce who's ready to address issues in your particular community. And then it helps to ensure stability over time. When the coalition has people who are coming together for a similar effort, the vision and the mission, everyone's staying true to that, it becomes sustainable. And the coalition can continue to sustain whatever issues or whatever projects are found to be the ones that you guys want to focus on for that year, so, or that time period. Okay. So what do levels of membership look like? This is one I really like to look at levels of membership because everyone may not be able to participate in the same way. So with levels of membership, you want to look at who are the people who are serving in what roles for the coalition. You may have some who are at every single meeting and they absolutely can be there and do everything that is needed on a day-to-day basis. Many times that's your coalition staff. So coalition staff, they're there to serve the coalition as staff members. That's your directors, your coordinators, your facilitators, and then there could be other roles later for coalition staff. Then you have your core work group. You all may think of your core work group as the people who are often at meetings, or it also might be the subcommittees. Subcommittees fall under the core work group because they're going to get the things done based on what the target is for that particular committee. But then you have your key stakeholders, and key stakeholders fall into 2 categories. They can be formal leaders and they can be informal leaders, but the key stakeholders are the ones who have an interest in what the coalition is doing for a variety of reasons. And let's look at what it looks like to be a formal leader. Those are going to be like the people who make decisions at the top level for their sector. So the chief of police, the superintendent of schools, religious leaders, your elected officials like the mayor. These are people who were assigned to be leaders. That's how you can think of your formal leaders. Your informal leaders, it's just the opposite. They weren't necessarily assigned. They're kind of naturally chosen by the group, and people choose to follow them. They have an impact. And if you can think about your community, who might be those people in your community? It could be an active parent, someone who's lived there for a really long time. It might be an elder that people respect. It could be a coach. It also could be a religious leader. The hairstylist, the barber. How many times have you heard hairstylists and barbers say they have people who sit in their chair and they hear entire life stories, and they're kind of serving that role of the encourager, the inspirer, the counselor sometimes. So these are your informal leaders. All right, so here is activity number 2. So thinking about your informal leaders, Who do you think you can connect with in your community that's not currently being reached for the coalition? And think about those tiers. They may not be someone who's necessarily going to be there every single meeting. There may be places where you need them. You really need them. It could be on a short-term action team. Short-term action teams usually say we have this project or this goal. It's going to last for 6 months or it's going to last for 3 months. And then if you're interested in another project or goal, then they might come on for that as well. Yes, so businesses. Susan, if there are businesses that are like, we definitely need that business on board because maybe they're a pillar in the community and it's that recognizable place. When you think of Apache Junction, like that place is recognizable. People know that place or know that store owner or know that business owner. That's awesome. Any others? Yes, parents, grandparents, and other caregivers, absolutely. Are there any like community leaders, informal leaders that are well known in the community that people just kind of know that grandmother outside of Shelley? Youth leadership. If you have youth leaders in the community who've been very active or maybe recently won awards, maybe like your class valedictorian or whoever the incoming class will be for next year, maybe the student body president who's going to be the new student body president, that's an elected person and that could be both a formal and informal leader. So those are the kind of people that you want to be thinking about. In this stage of building capacity, you're constantly doing recruitment and retention. So you're wanting to bring new people into the fold and you're wanting to retain who you have as well. So you all keep thinking about that, okay? All right, let's talk about planning. The next 3 steps we will go through a little bit quicker. In the planning stage, this is when you're really starting to look at what is the plan? What is the problem that is being looked at? What is the problem that you're up against? What's the outcome that you want to see with that? So what strategies are you going to use? And with those strategies, what will those activities look like under those strategies? We're going to go a little bit deeper into strategies. So we'll come back to that. With the implementation now, this happens after you now have done the planning. Planning's done, we know what our outcomes, well, what outcomes we'd like to see. We know what strategies and activities we're gonna use. So now we're gonna implement it. And in implementation, very simple way to go about that is to look at what's the activity, who's gonna be responsible for it, and by when. Always, always, always have a by when, because the by when allows you to track. And whenever coalition staff is going to be submitting any reports or giving updates to say this is where the coalition is, or maybe looking for grants to kind of sustain the activities, these are things that they will need. These are critical things that they will need. So the activity, what you did or what you plan to do, who's going to be responsible for it. The who could be an entire agency. It could be a sector. It could be, and when I say sector, for example, the schools might be responsible for something and the schools have determined as a sector, yes, we'll take that on. And so that who is the schools, but then you do need a person attached to that. So maybe that's the Education Outreach Committee. And then with that committee, then they can kind of help to monitor what's happening with the by-when. Any questions about, this is just a 3-step simple action plan. Any questions about that, you all? No? All righty. Okay, last step in the 5 steps is evaluation. This is the point where you're looking at, there's sort of a natural evaluation point, which is at the end of a grant year. Natural point. Now those grant years may vary. It could be your federal fiscal year, which ends at the end of September. It could be the state typically observed fiscal year, which would be June, the end of June, or it might be your calendar year, which is a little less used, but that's up to you all to determine when are you gonna focus on your wins? When are you gonna look at, do we go back in this process and what are we gonna assess? So in the evaluation, I'm missing a slide. In the evaluation, that's what you're doing. You're measuring your impact and you're looking at what did we do? Did we do it well? Should we continue to do it? Where do we need to adjust? And that's your evaluation process. So all of this rests on cultural competency and sustainability. If you can make it through a year, how much longer do you plan to make it? And do we have a short-term plans and long-term plans? With cultural competency, you want to involve as many diverse perspectives of your community as possible, because you really want to hear, you want to get that comprehensive picture of what the risks are, as well as the protection, what the strengths are. So in your community, what does your community look like? Do you all remember a couple weeks back when we sort of did an outline, you sort of drew your community? In there, you probably only put the buildings or structures or landmarks, but we probably didn't put the people. Maybe some of you did, but most of you may not have put the people in there. So in looking at the people, who are the diverse people in your community? What are their ages? What are the jobs that they're involved with? Are they involved in other activities where you would go into to make sure that they get word of what's happening? So there's so many different places you can look at what is the diversity of our community, and the coalition is really the place to help foster that just sort of description of the diversity of your community. So additionally, with cultural competence, I just said diversity tons of times. Having a diverse representation of your community helps to ensure you have the story, more of the complete story. That can take time. It may not be that it looks as diverse as it will, and then sometimes it looks extremely diverse, and then you see that changes. So you're kind of always going through this process of making sure that you're including everyone in your community that wants to be included and can be included. This also can include having flexible meeting places. So for example, Zoom has become really an awesome tool, because there may be people who wouldn't have been able to leave their desk, or for instance, like students, they may not be able to get to a building on time after school. So Zoom really does help with some diversity with meeting place. You can change your background and go wherever you are. This is not my actual background, right? I don't have books behind me, but you really can create some of that way too. Keep in mind also transportation. For some, let's say that you have a population in your community that isn't driving, or maybe they don't drive so well, or maybe there's just a need to transport people. So maybe going to the place, like having sometimes coalitions will have a roving meeting. So the meeting is at a different place each time. That will be decisions that you all can make later. Oops. And then with sustainability, are you thinking about how we're going to sustain this? How will the plan work so that it sustains the coalition and the integrity of the coalition? Are we thinking about down the line, and how far down the line we're thinking? Sustainability really should be the first place, based on the way that I was taught, it should be the first thing you're thinking about when you're thinking about a plan. Starting with sustainability gets you in that mindset of this isn't a one-time thing. This is something that we want to see our community prosper from and benefit from for a long time. So what are our time frames? Are we talking about 6 months for this particular project? Are we talking about 5 years impact looking down the line? What do we hope that we will see? What does our vision communicate? And when do we hope that vision will be a reality? And for how long will we be able to sustain that? So always incorporate that into your plan. All righty, so now there's more work. The 7 strategies of community change. So I will tell you this, it's very, very wordy. You all will be getting a link if you haven't already gotten the link. And in that link, it's going to give you, there's pages that you can go to really get into each strategy. For some of you, you're gonna know right away, this is the one that I'm really drawn to. All 7 strategies, when you use them, you have a much greater potential impact on your community. So I'm going to break them down. All the words are going to be on the screen, tell you in advance. So don't worry about trying to read through all of the words. I just wanted to put it there just to make sure that you know that there's a little bit more substance behind just the title. And I feel like I missed, let's just make sure that I do have one other document that I'm going to put in the chat box before we finish, just so that you have more of it's just another in-depth understanding, SAMHSA's perspective on on the SPF, on the Strategic Prevention Framework, and they updated a document a couple years ago, and it's a really comprehensive document. It's really easy to understand. So I'm going to put that in the chat box. That's just for your reading pleasure. So 7 strategies of community change. Let me get this box out of the way. There we go. All righty. So there are 7 strategies. The first 3 are individual strategies. Remember in the beginning, I said that this gives us an opportunity to have more population change. Well, we still have to have an impact on individuals if we're going to have a population change. So the first 3 strategies in the SPF are focused on individuals. You're going to be providing information, building some sort of skills, and providing support. Those are the first 3 strategies. So what you see in the dark gray are the first 3 strategies. What you see in the lighter gray are going to be ideas for how you can do that. So with providing information, those are like your presentations, your workshops. Even when you're gathering data and you have a little bit more information about what the problem looks like in community, doing presentations on that or giving information on that. That could be to those key stakeholders. It can be doing it through the website. You might do it through social media. There's so many different ways where you can provide information, but that's strategy 1 of the 7 strategies. The second one, building skills. This is where you might do training. This is activities that are designed to increase skills of whoever the participants are in that setting. So it might be members of the coalition like this. This is a skill building workshop. Well, we're providing information and we're building skills because you are going to do the work in just a second. It also may be retreats that might happen annually in the summer. It could be a planning retreat for a committee, or it could be a planning retreat for the entire coalition. There's something that's happening where the participants are feeling like I am more skilled at doing whatever this thing is that we're intending to do. The third strategy for individual strategies is providing support. This is just opportunities for people to participate in activities that are going to reduce the risk or enhance protection. So you might be providing, that target might be youth, for example. Do we have Parks and Rec that is providing classes for the summer for ages, whatever through whatever? Let's say that your target are middle school youth. Well, how many classes do we have in the summer that are going to engage middle school youth that Parks and Rec is offering? And maybe kids can't all pay to go, but Parks and Rec is offering some sort of summer scholarships or summer incentives or something. That would be providing support for youth to participate in activities that will reduce their risk, or activities that enhance protection, like doing some things for the family, like family nights, or I can't remember what the pool day, I had it in my head for weeks and now it's like gone. In my mind, we're deep into summer. It's not even 110 yet. So those first 3 strategies are individual strategies. Okay, so for this activity, think about activities that will increase awareness about fentanyl and counterfeit pills. Okay, so I'm going to have you put that thinking cap on for a bit. And we're going to unmute ourselves for this one a little bit, because we're going to see, are we ready to do this, or are we we still need a little bit more. And this is such a fast training that you're not expected to be experts unless you already were an expert in doing this. So when you think about activities that will increase awareness, who would be the target? Who would you be targeting to increase awareness? What would you do to increase that awareness? And who's going to be responsible for doing it? I do have a cheat sheet on the next page, but I'm not going to show it to you yet. So who would be the target? What's the activity that you think the coalition should do? And who should be responsible for it? And this is not putting anybody on the hook for anything. This is just an exercise to pull some things out.
One possible target would be parents.
Yes. So is that Richard?
Yes, I'm sorry. This is Richard Dyer. Okay. So the target may be parents, but the activity, I've always wondered if parents even understand what they look like. Maybe something where police or law enforcement could show what some of this stuff looks like when they find that their child has it.
Okay.
And as to who's responsible by when, I don't have that answer.
So, okay, I love that, Richard. Thank you. So parents are the target. We're going to provide them information, which would be to help build awareness so that they know what to look for. right? And who would be responsible? The question would be, who on the coalition is appropriate for doing those presentations? Here's a couple potential. It could be the Education Outreach Committee, could be. It could be individuals on the coalition who have access to do parent presentations. So if there is already an entity, a group, an individual on the coalition who knows you'll have a captive audience in July, in September, in August, that could be a person who's responsible maybe for one presentation. Does that make sense to you all? Oh, look at my chat box. Okay, so another target would be vulnerable populations. So what we want to do with that is we want to get very specific. So when you are looking at your target, vulnerable populations gives us here. So what might a vulnerable population look like? It could be, the first thing that pops into my head are like kids who may be, families who may have been CPS involved or DCS involved. That might be a vulnerable population. Or I know right now we don't really, I'm going to kind of take Vanessa's thunder a little bit. We don't really have know what the hotspots are in Apache Junction. So right now we're going off of, there really aren't any hotspots. So that's some of the data that we have thus far. And so with that, who could the vulnerable populations be? With Shelley explaining the number of older adults who come into the community at different times of year, that might be a vulnerable population because maybe kids get it from them. So these are the kind of discussions that you would want to have to determine who your target is, okay? Any new ideas now that I've talked that out a little bit? Any new ideas pop up for you all? And I say you all or y'all a lot because my grandmother's from Texas. Okay, so keep thinking on that. This conversation will continue on to the committee who is working on this issue. We will be completing an implementation plan that is going to have these things that the coalition will then be on the hook for 4 months. Youth, absolutely. So the activity for youth, Shelley, can you think of, off the top of your head, from the toolkit, can you think of anything from the toolkit that would be appropriate for targeting youth?
It seems like every piece of the toolkit had some sort of video that you could put on social media pretty easy.
Perfect, perfect, perfect. Yep, absolutely. So I'm going to pull up what this implementation plan looked like. That's our next slide. Oh, here we go. So when the plan is completed, this is almost all of it. But what you'll see here is the committee has already chosen to focus on 2 strategies. The first strategy is going to be to increase education and awareness. The second strategy will be to increase resiliency in youth. So you can already see that in strategy 2, there is a target that's identified. In strategy 1, there's not necessarily a target that's identified. So there can be some things that happen with the variations in targets in both, even though youth is identified as a target in strategy 2. And I'll show you how in just a second. So as you take a look at this, these are things from the toolkit. If you look under strategy 1, you see the fentanyl fact sheet, the rise in fentanyl PowerPoint, the counterfeit pill education postcards, and the counterfeit pill door hangers. Those are all tools that are in the toolkit ready to go that the coalition can use right now. I left that in there as an example, not to say that that's what the committee is going to stick with, but I just left it in there as an example so that we can kind of play around with this a bit. So when we look at how long you would want to do this, the coalition has to be comfortable with the amount of time spent. And don't think that you have to do a tremendous amount. In fact, you don't want to take on more than is possible for everyone. So it might be that presentations happen every other month. It might be that, you figure out a way to space it out so that the awareness continues to build, but it's not like every single day there's a coalition member doing a presentation. In the beginning, that might be very tough to navigate. It could get to that point because maybe you have enough hours, enough people power to make it through that sort of a plan. But with 4 months, the coalition has 4 months to implement this plan. With 4 months, what would be feasible? So if we took, for example, passing out a fentanyl fact sheet, can you all think of places where that fentanyl fact sheet might be useful for that to be? And you can drop it in the chat box if you prefer. Oops. I'm gonna go to the next one. There we go. Yes, in the libraries, at the pediatrician offices, yes, at the community health organization. A place where people can kind of pick up and go, or where they might see it. You know, it has a nice visual target where somebody might see it across a room or on a wall, at the doctor's office in the waiting room. Yes, at the multi-gen center, absolutely. So if these are places that you all already know are viable options, and maybe you represent that sector, then the where and how it would be implemented, that would go in that column. The how many, well, let's just go on the low end. Let's say that there's 35,000 residents, right? With 35,000 residents, how many fact sheets do you think are reasonable to get out? That would be a decision that would need to be made. And then from whatever that baseline is, you can go up from there. Sometimes, and Tempe Coalition, what they have done is they've put the information in the electric bills. So when a resident of Tempe gets an electric bill, you get every single resident who gets that electric bill, it's an insert in their mailer. And so that's a nice way to just get a huge injection of eyes on that awareness campaign. And then obviously the intended audience, in that case, the electric bill, more than likely it's going to be the parents that are getting the electric bill, or the adults in the house. And this would also be the estimated reach would be, if there's what, 200,000 people in the city of Tempe. So that would be, that number would be the number that they would use. Yes, the pharmacy prescription bags, you know, I have never had the opportunity to do it myself, but I have seen that work really well with having just kind of the inserts in the pharmacy bags. And that is another great option. I don't know how many pharmacies are in Apache Junction, but you guys would know, either do you want to hit all of them? Are they just the CVS? Is it the local pharmacy? Is it Walgreens? Is it the Walmart pharmacy? You would know which ones you'd want to target. And there are some that are very open, and some, like CVS, tends to be pretty open. And some it might take a little bit more legwork. Okay, I'm going to go to the last 4 strategies. You can keep dropping stuff in the chat box too. The last 4 strategies, this is environmental change. This is the big one. This is where you're going to get the biggest bang for the buck. So those first 3, we're focused on individuals. The last 4, we're trying to do something in our community that's going to have a lasting change, because everyone is going to benefit from that. So if we enhance access to different things or reduce barriers, we're improving some sort of system or some sort of process that's going to increase our ease and ability. So for example, like your drug drop boxes, it increases the ability or the ease for people to get rid of their leftover medication. So if those are already in the community, you might increase awareness about that, you know, just so that people know that these are there and they're there all the time. You don't have to just wait for a drug take back day. Changing the consequences or creating incentives or disincentives. It just increases the likelihood that you're going to get the behavior that you're looking for. And one of my favorites, this is a personal favorite, is doing public recognition. And public recognition might be for your adults as well as your youth. That could be in your local paper. That could be on local radio. That could be on your social media. Those places where you want to recognize the individuals who are contributing to the protection for youth in your community, which may even be peers protecting their peers, peers who are making positive choices, businesses, officers, teachers, elected officials who are deserving of some recognition because they are doing exactly what the coalition's mission and vision or doing something that's related to the coalition's mission and vision. Another thing on here for disincentives would be like citations and fines. I'd let you all discuss that. Citations and fines can go a lot of different directions, but there might be ways in fentanyl and counterfeit pills and prescription drugs, it might be a little bit difficult, but I think about like alcohol, for example. In some cities, there are ordinances that say you can't have an ad that's over a certain dimension on a window outside of the store. And so if a store owner doesn't follow that and they put a bigger one out there, then they may be fined for that. So that would be a disincentive to not put, you know, those sort of ads up. So that's just one example that I can think of right away. Okay, the last two, physical design. Physical design would be changing something that reduces the risk or increases protection. The easy example to think of here is putting more lights in a park that just makes it more difficult for people to do things in the dark, or reducing the number of outlets that are dispensing. So related, for example, to marijuana outlets or marijuana dispensaries, that might be one. So I'm just going across lines. You don't mix substances when you're going through the strategies. You stick to one because one strategy isn't necessarily a catch-all. The way that you would handle one substance isn't necessarily the way that you handle another substance. And then the last one would be modifying and changing policies. Modifying and changing policies, I started off with the seatbelt example. That's an example of modifying or changing a policy. It might be an initiative. It might be, a policy doesn't necessarily have to mean that it was voted in as law, but it might be a standard practice that you see happening in AJ, and this is just the way that we do things. So that would be changing some sort of policy or modifying a policy, or it could be a law that is voted in. So those are your 7 strategies of environmental change. I am going to stop the share and I'm going to ask, do you all have any questions? Was I talking too fast? Thanks, Scotty. Thank you, Vanessa. So that's a lot in a very short period of time. There's more time to continue to give more of those important pieces of training. It can be a lot. The more that you all do it, the more you get engaged in it, the easier it becomes to connect the dots. So as the committee is going to start to work on the implementation plan, I think that what we'll see is there'll be more light bulbs that go on, more thoughts, more contributions of, oh, you know what, I hadn't thought about this before, but I think this could fit. And then it helps for a more robust conversation. And thank you all, appreciate it.